In the United States, allergies, asthma, and COPD represent a significant health issue. In fact, as many as 100 million patients can be affected every year by these conditions combined. The symptoms of allergies include something as simple as watery eyes, itching eyes, nasal congestion, sneezing, coughing, and they can range all the way to the severe, which would be life-threatening, something such as difficulty swallowing or breathing, hives, low blood pressure, nausea, and vomiting. Allergy testing is usually done by the dermatologist or the allergist if you don't know what it is that is your trigger. Asthma affects approximately 25 million people a year, and it represents a significant health issue in the United States. We know that asthma is a chronic inflammation of the lungs, and it causes irritation, and it causes symptoms such as shortness of breath, tightness in the chest, wheezing, coughing, those types of symptoms, and they can range in severity from mild to severe and even life-threatening. The diagnosis is made usually with pulmonary function tests in the doctor's office. A chest x-ray may be helpful. We know that asthma sometimes can be brought on even by something as simple as exercise. If that is one of your triggers, then you certainly want to have an inhaler available to you at all times to use before you exercise and certainly after you exercise if you're experiencing symptoms. But if you're experiencing symptoms that don't resolve with the use of your inhaler, you need to be seen and evaluated immediately, usually in the emergency room for severe shortness of breath. A COPD is a chronic obstructive pulmonary disease, and it represents a significant health issue in the United States. It's a chronic process that involves inflammation of the lining of the lungs, and the patient has a lot of mucus production and frequently coughs. We know that COPD is the third leading cause of death in the United States. In regard to patients with asthma and COPD, we know that smoking is a leading cause of COPD. We also know that secondhand smoke is a cause of allergies and problems with patients with asthma. So it's very important to stop smoking if you're a smoker. And finally, an important take-home message is that if you do have these conditions, take maintenance medications, medications that you can take to prevent the symptoms. And if there are known triggers, things that cause you to have these symptoms, try to avoid those triggers. And just take good care of yourself and see your doctor for regular visits as well.